Welcome to Advancing Health. New York City has long been considered one of the great food meccas of the world. And these days, some of the best tasting and most nutritious meals in the Big Apple are served in hospitals. Hello, friends. I'm Tom Hetterly, Senior Communications Specialist with the American Hospital Association. And it's a pleasure today to talk about a vast improvement in patient care that is sometimes overlooked: the meals patients and families are served during their healthcare journey. I'm not just talking about taste and presentation, but significant upgrades in nutrition value, high quality ingredients, and the ability to tailor meals to patients and their needs. I'm joined today by Dan Dilworth, Senior Director of Food and Nutrition Services at NYU Langone Health. Dan, thanks so much for joining me on Advancing Health today.
Awesome, and thanks for having me.
Let's set things up. You and your team have invested enormous effort in the past several years in radically overhauling, Langone's food system. Please give us a picture of what's been going on.
So our journey actually began about 12 years ago after Hurricane Sandy. NYU was decimated by that storm and they had to rebuild. So really we said, how do we want to do that? We have this opportunity to build new buildings and rebuild a program. And we really wanted to be the best in class in doing that. So, the approach we took was actually very, very simple. It was, let's focus on using really wonderful products, the best ingredients, and start making everything in-house. And that's sort of the base of how we did it. Of course, it's a lot more complicated and it's been a long winding road, but that's really what we prioritized.
What has the reaction been from patients and their families who are customers, so to speak, of of Langone Health?
Our changes have gone over very, very well. I must say that, as part of our process, we've removed all deep fryers from every kitchen within our organization. So the removal of French fries did upset some people. But aside from that, I think it's been overwhelmingly positive feedback. And, funny enough, this morning in snail mail, which is a rare thing these days, I actually received a letter from a patient who was here at some point in the last several months, thanking us. And she cited, the salmon with the salsa verde and our sauteed kale, and was calling out these specific dishes, saying how wonderful it was to get this level of food at a hospital. And I think those are really the best moments when we can hear from a specific patient, letting us know about their experience. But yeah, overall, it's gone over very well.
And nice to get that thumbs up. I imagine people are delighted. You come from a restaurant rather than a healthcare background. So how is that an advantage in looking at the menu and deciding what kinds of changes needed to be made? And did anything surprise you when you took this on as a project?
So yes, you mentioned I come from restaurants, but it's a little bit more than that. I've worked in just about every area of food and beverage that you can imagine: catering, airlines, hotels, restaurants. And it's funny because I think hospitals are actually a conglomeration of all of those things. Each of those different areas has its own set of challenges that you have to navigate. On an airplane, you're pre-making food and it has to get reheated in the air in a steel box. In catering, you're doing kind of the same thing, but on the ground. I've pulled a lot of sort of skills that I've learned in those areas over the years to help inform what we do here at NYU, knowing that, we don't have a kitchen next to every patient bed. And that's something that's really interesting to me, is the sort of logistics behind this. How do you make really fresh, amazing food and then transport it through hallways and up elevators and then get it distributed to a patient bed, which is decidedly not a restaurant table? I think just pulling from that background and different things I've learned over the years has been really helpful in this. But again, it just comes down to the same things. It's, using great fresh ingredients, the best quality fish, the best quality vegetables, and then delivering it with wonderful hospitality, I think is the key, no matter what happens with the logistics and behind the scenes.
I would think New York is probably, correct me if I'm wrong, but maybe one of the easier places to source fresh ingredients. Is that an advantage just because so many ingredients, come into the city for so many different reasons, but you don't have any trouble getting your hands on the kinds of things that you want to be serving patients?
100%. I mean, we're in probably the best place in the country to get amazing ingredients, past maybe California. Our fish comes from the same purveyors that I've used for years in, Michelin-starred Manhattan restaurants. But having said that, we don't have the advantage of being able to run down to Union Square Green Market and pick up vegetables because of the sheer volume of the food that we're serving. So we're serving over 9,000 people a day across all 5 of our campuses. And, that does put some limitations on it. So we really focus on working with great purveyors to figure out how can we get local vegetables and the best quality items at that scale. And then, knowing that, in theory, this is an easy thing, but we do have campuses ranging from Manhattan all the way out to Suffolk on Long Island. There is a level of complexity there, but the number of amazing purveyors and vendors that we have to pull from make it pretty straightforward and easy, which is a great asset.
Well, it's also remarkable, what you just mentioned you're serving 9,000 patients a day, and I understand that the Langone system puts a premium on tailored meals when possible that are aligned to a patient's personal taste and preferences. How do you pull that off?
So that's really interesting. So just the one caveat. So we're serving 9,000 people a day. So that's patients along with our coffee shops, our restaurants, our cafes, our catering. But when it comes to medically tailored meals, we have over 15 different special therapeutic diets. So that could be anything from a consistent carbohydrate diet to a low sodium diet. So depending on what a patient's condition is, the doctor can, sort of flag them for that specific diet. And that tells us how much sodium can that patient have, what level of sugar can they have. If somebody has diabetes, any number of different conditions will fit into that. And we have essentially different menus that mini menus that are put together that we will make available to that patient. But the best part about what we do here at NYU is, we have a pretty expansive patient menu. We have daily specials, and every patient has the ability to pick what they want to eat. We're not telling you what you have to eat. We're not just sending something up to you. But as long as you're not in surgery when orders are being taken, patient can pick: do they want pasta bolognese or do they want mac and cheese? Do they want chicken breast or do they want roasted salmon? And I think that level of choice is something that's really amazing. And that's something that's very personal to them. I think it really helps give a better experience as part of the overall stay at the hospital, and being able to know, pick what kind of tea you want, or what you want, what kind of cereal you want for breakfast. That can be something that just gives a sense of sort of comfort and home when you're in a place that's definitely not your home.
That's a great point, and I was thinking it's probably also a big psychological advantage to feel like you have some control over the things you're picking to be brought to you to eat when then, depending on the nature of your stay in the hospital, you don't always have control about some other aspects of what's going on there. But I was wondering if there's in addition to patient feedback, which I imagine is very positive, do you have any data that would indicate that this move to healthy food is actually making a medical difference? Sodium levels dropping or diabetes being treated just through food.
So we're actually right now working on developing a number of different dashboards to start tracking data like this. It's not something that's, well, one, very easily trackable, but it hasn't historically been tracked across the board. So we're really prioritizing right now: how do we gather more data? How do we turn that into something that you can see on a day-to-day basis? And that could be anything from things you're talking about to what utilization do we have of different menu items? What are patients ordering most frequently? How long does it take for a meal to get from our kitchen to different hospital units? And I think we're taking this holistic look at data because NYU as a whole uses data as a tool to make decisions, right? We're not making decisions because Dan thinks it's good. We're making decisions because there's proven facts behind it. I'm really excited to see those dashboards come to life, and we're going to continue growing and refining them over the coming years, and hopefully be able to share some data that's really impactful to the world through the use of those.
That's exciting. I'm looking forward to hearing more about that when that data becomes available. At the same time, you're also moving ahead on so many fronts at once, and I'm referring to carbon emission goals, also trying to reduce the amount of single-use plastics as part of the overhaul. What can you tell me about that? How's that working out?
So NYU has a goal of carbon neutral by 2050. In researching where the bulk of our carbon emissions come from, one would think, oh, it's from the electric and the utilities that you use. A lot of it is from the products. And, I say that because something made of plastic that's produced overseas has to go on a boat, in a box, in another box, get uncrated, repackaged, distributed, delivered. That whole process is incredibly impactful. We're sort of starting to focus in our department on things that we can make a big change with immediately. And for us, that's a lot of that has to do with removing plastics. It's not great for the world. It's not great for your body. And more on the market, there are better alternatives, especially for things like bottled beverages. There are a lot more bottled beverages out there right now that are packaged in glass or aluminum, which are endlessly recyclable and definitely ideal. So this last year, we reduced our plastic bottled beverages by 44%. and are working pretty aggressively to turn that into a zero, hopefully by the end of the year. But that's a loose goal. Past that, it's we're also looking at the health benefits of removing plastic from food service. So there's the benefit to our planet of using less plastic. But more and more there's research saying that plastic, especially when it's heated, is really terrible for our health. So there are some really cool researchers here at NYU that are really focusing on this. So as a department, we're partnering with them to figure out, as we get rid of plastic, which items are we bringing in and which have the least amount of risk to our bodies, our patients' bodies, our staff, and our guests. But overall, I think moving towards compostables is a huge goal. In the last couple of months, changed all of our cutlery over to being compostable in our retail cafes. Patient meals are next. And I think alone that move saved us about 2.5 million pieces of single-use plastic going into landfills a year. So a lot of good stuff. And, it's amazing to work for an organization that puts resources behind this, because it's not cheap to do these things. And NYU's dedication to this mission has really enabled us to make some moves here.
Congratulations. You're really making important progress on so many fronts and advancing health at the same time. It's amazing. You're probably aware about a month ago, the Centers for Medicaid and Medicare Services announced a voluntary pledge the hospital could sign related to their efforts on healthy food. The AHA has endorsed this. Seems like you guys have really been ahead of the curve on this whole thing.
Yeah, so that's the great thing about this is for years we've already been doing a lot of the things that are a part of that pledge. So using minimally processed foods, prioritizing from scratch cooking, simple vegetables and proteins, reducing the amount of added sugar. We'd love to reduce all added sugar. However, you can't get rid of ginger ale for patients, and that's always going to have added sugar. But even several years ago, we switched our ginger ale to a product that uses cane sugar instead of high fructose corn syrup. So even in those places where, it's a sort of necessary evil, we're still trying to use the best thing possible. But at the end of the day, like I said at the beginning, if we prioritize great, fresh, simple ingredients, we're headed on the right track.
Well, you're really setting the standard for the field right now, and I congratulate you for that. I've got to ask. I've read that Langone's food is so excellent that some patients actually ask for recipes. So, will we see a Langone Health cookbook coming out one of these days, or a show on the Food Channel?
There's nothing I would love more, but funny you should ask about a cooking show. So we actually do shoot a cooking show right now. We've shot it for about 6 years. We've done 58 episodes so far. It's called Cooking for Wellness. It can be found on our YouTube channel. Historically, this program has been sort of directed at our internal stakeholders, and it's featured all of the amazing clinicians and experts we have on our staff giving guidance on food. We're going through a bit of a relaunch on this right now, where we're redirecting this as a tool for our patients to provide them with like real life actionable guidance on cooking, on nutrition surrounding specific diseases. We have this wealth of expertise from our doctors, from our nurses, from our researchers. So we love the fact that we're able to leverage that and then combine it with our culinary team and really create a program that's teaching everyone out there sort of how can you cook at home in a realistic way to solve for having a certain disease to being on a certain medication.
Given your experience in redesigning the menu at Langone, what advice would you have for other organizations, health systems, or hospitals who are interested in doing the same thing?
I think one big piece of advice I'd give other health systems is typically, frozen food is a big part of the food and nutrition program in healthcare organizations. And, everyone assumes that going to fresh vegetables is a sort of big mountain to tackle. In my opinion, it's much easier. It's actually just that simple. Buy fresh vegetables. When you buy a frozen vegetable, you have to store it, you have to thaw it, you have to process it more differently, you have to dry them out. It's much easier, and it ends up being a bit of a labor savings if you just go with straight vegetables. It's kind of counterintuitive. However, in the long run, it's going to give better nutrition, a better quality product. Many of the purveyors that sell these frozen or canned or processed ingredients also have fresh vegetables. And even if you start small, like you don't have to reinvent the wheel overnight, just switch from frozen carrots to fresh carrots. That's an amazing first step and pretty accessible.
Well, it may be an overused word, but I think what Langone Health is doing is truly awesome. And congratulations on the effort you're leading and the difference it's making in your patients' lives and those of their families. So thanks again for your time, and really appreciate you being on Advancing Health today, Dan.
Awesome. Thanks so much.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.